All right. It is 2:55, except for one thing we don't have. We don't have a county clerk. Excuse me. Need a clerk. We won't be. We'll be waiting just a moment for our county clerk. All right, it is 2:57. This is the Commissioner's Court workshop. Before we call it to order, let's go ahead and say our prayer and our pledge. I'll lead us in the prayer. Most gracious Heavenly Father, we thank you for this day. We thank you for the blessings that you've been and given to us. Father, we are at your mercy. And Father, we ask that you be with us and all of those, Lord, that are hurting, suffering, needing our first responders, our entire community, Lord. Please be with us. Help us to have clear thought, clear mind, and clear purpose. Father, we thank you for all you've done. We ask you to forgive us of our sins. In Jesus' name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Well, we do have a quorum, and we'll call this meeting to order at 2:58. The purpose of this workshop is to participate and discuss a statewide COVID-19 call with Governor Abbott. There are no citizens' comments at this time, so we will move to item 1, which is participate in and discuss state COVID-19 call with Governor Abbott. We have here the system set up so that hopefully everyone will be able to hear clearly. What the governor's comments are. These are specifically related to his action today in the issuance of Executive Order number GA-15, GA-16, and GA-17. GA-15 is relating to hospital capacity during this disaster, which is actually set out to replace GA-9. And according to the current incarnation of the order, this one is set to expire on May 8th, where GA-9 was to expire on April 21st. GA-16 is relating to safe strategic reopening of select services as the first step to opening Texas in response to the COVID-19 disaster. And this is the order that actually will replace GA-14, which is the basis of most of the orders that are in place today. And GA-17 is the governor's order that is relating to the establishment of a strike force to reopen Texas, which the governor spoke to at length, and I believe even at the press conference, Mr. Huffines spoke to, is going to be the chairman. I've never known these calls to begin on time. So, Mr. County Attorney, is there anything during this time you would like to add or bring to the court as we wait on the call?
Well, one thing that we know that he's going to talk about in the call that we can address is that Order GA-15, which is the order on medical treatment. And, of course, we have a similar provision in what was in our order that, in essence, prevented the hospital or hospitals from providing elective procedures. Our order is set to expire on the 30th of the month, whereas now with GA-15, that's going to be relieved at midnight on April 21st, which of course is next Tuesday, the date that we meet. So one thing that we will need to do and address in our order next Tuesday will be to modify our order to, my advice would be just to exclude that entire paragraph F out of our existing order, which would then allow the hospitals to operate under GA-15 in the governor's order.
Okay. Yeah, in his order, it specifically speaks to decisions made that are commonly accepted and on standard of clinical practice and not depleting the hospital capacity or personal protective equipment needed during the scope of this disaster. And I believe that was one of the driving factors in his initial issuance of GA number 9. And I may sound repetitive here, but GA-9 was to expire, as County Attorney said, on April the 21st when we meet again, so. Move to GA-16. This is where they went into great length. It is the largest one of the orders. And GA-16 actually replaces GA-14. GA-14 was the basis of all of the orders across the state of Texas, which over the last several weeks now, there's 116 counties that have based their orders off of what was GA-14 that is being replaced by GA-16. That's basically 26,369,000 people that were directly affected by GA-14. 89%, little over 89% of the entire population of Texas were directly affected under the orders and the powers derived from GA-14. And this makes some modifications to it, but it is considered where it speaks to the social distancing requirements. They're still wanting to lessen some of that. The governor still is not on the call. Okay.
The other interesting thing about that order is he specifically refers to the CISA version 2.0 and adopts the CISA version 2.0, and there's actually a CISA 3.0 that came out. So it'll be interesting to see if they go back and amend that, or was that a mistake on the governor's part? You know, did they intend to go back a version and continue with CISA 2.0, or why they didn't go with the newer version of 3.0.
When was it to expire? G14, GA14?
It was
The
That was
30th.
the 30th? Okay.
And the 16 is, they've left that same date there.
Right.
Yeah, we were notified at basically 2:17 this afternoon of the release of the CISA 3.0 from the federal government. So I'm assuming they will have to go back and I don't guess they have to, but
I have not looked through, as you guys know, that list of essential businesses that's defined by, in the CISA documents is about 20 pages long. I don't see where they've added a whole lot of new categories. They've just gone through and tweaked a lot of the language throughout and changed some of the language in it.
it looks very familiar. I mean,
Of course, that is also that list that is so broad that it is 20 pages. I don't know
Right.
how you could possibly go in and add any more categories of businesses that make it essential. But that is probably something that I will try to do for the order on Tuesday, is update our order to reflect the changes from the CISA 2.0 list into the CISA 3.0 list.
it's in the new GA16 where the discussion of what the governor had specifically written into his order. This would be on page 3, the second to the last paragraph. It looks very similar to the same wording in GA14 concerning eating or drinking at bars, restaurants, food courts, gyms, massage establishments, tattoo studios, piercing studios, or cosmetology salons. So it looks like there's no change there.
Please go ahead, sir.
Thank you, and most importantly, I want to say thank you
The
to
Governor of Texas.
everybody's on the phone right now. The local leaders who are on the front lines of dealing with the coronavirus at your local level. We know that you're working hard and tirelessly, and I know that your constituents appreciate all of your hard work. I want to take some time to update you on what happened today, what to expect going forward, and then answer questions for as long as we can. So, as you may know, I issued an executive order today that provides modifications to the pre-existing stay-at-home order. And what we wanted to do is we want to begin this process of opening Texas, ensuring that it's done in a safe way that continues to mitigate the expansion of COVID-19. This decision was made in part on observing what was going on with COVID-19 both nationally, in the state, and at the local level in counties across the entire state of Texas. And it was done in a way that relied upon advice from doctors. So every decision that we make are driven by two things. One is data, and the other is doctors. If you didn't hear earlier, we have a team of 4 doctors that are part of this collaborative effort that we've established called the Strike Force to Open Texas. The 4 doctors on the Strike Force, they include the Chief Doctor for the State of Texas, Texas State Department of Health Services, Dr. Hellerstadt. Also includes a name many of you are familiar with, and that is a former legislator, but also a current doctor, Dr. John Zerwas. And then 2 other doctors. One is the former head of the FDA under President Bush, and also under President Bush, he's the former head of Medicaid and Medicare. And then another doctor at the Yale Medical School, who is a specialist in infectious diseases, and he runs the testing and tracing team of COVID-19 at Yale Medical School. So we have doctors who are well-versed and experienced in infectious diseases who are advising us about appropriate strategies to follow to make sure whatever we do in opening up Texas is going to be tied to the very best health and safety standards. Along those lines, we will be working through the remainder of this month on strategies in which we can open up Texas beginning in May. That announcement will be made on April the 27th, so 2 Mondays from now. And what's going to happen over the course of the next 10 days is the team of doctors, a team of business advisors, a full-time workforce that we have running this entire operation. They will be taking in a lot of information. It could be from you, it could be from your constituents, it could be from other people involved in the business sector and healthcare sector around the state of Texas. Allow us to process as much of this as possible and see what types of businesses can be open beginning maybe as early as May the 4th in ways that we ensure will not lead to an increase of the spread of the coronavirus. That said, there were some things announced today that will be effective before May the 4th. One is an area that is so desperately needed by a lot of patients in Texas who need better and quicker access to their doctor or nurse. If you go back to my order that imposed the stay-at-home policy, it ordered a cessation of elective surgeries. And so it provided, in fact, even a higher standard. It basically had to be only some emergency type surgery needed to save someone's life to be done. So bottom line is a lot of doctors and nurses were sidelined, unable to treat their patients, and a lot of patients were sidelined also. One reason why that was imposed to begin with was because we needed to make sure we maintain a adequate level of hospital beds available for COVID patients, and we needed to maintain an adequate level of PPE available to all the healthcare providers and first responders who needed to respond to COVID-19 patients. Well, because we have been able to dramatically increase the amount of PPE that we have coming in and that we are distributing. As one quick example, over the past week alone, we've distributed more than 6.5 million masks. And we have ongoing visibility that we will be able to maintain or maybe even increase those supply levels. And so we feel comfortable now with at least what I'll identify as an adequate level of PPE. At the same time, many of you may have noticed that there have been a large percentage of hospital beds that have remained vacant. They are there because we wanted them for COVID-19 patients based upon analyses and forecasts that predicted the situation far worse than what's turned out to be the case. You know, we saw what was happening in New York, we saw what was happening in New Orleans, we saw what was happening in Italy, et cetera, and New Jersey. And the last thing we wanted was to have Texas to be in a situation where we didn't have the capacity to treat all of our patients, where situations had to be made or decisions had to be made about which patient would be treated, and that's the last thing we wanted to face. Well, because we have so many beds available and so we have so many ventilators available, we now know that we can allow hospitals to return to utilizing more of their hospital beds for these other types of surgical procedures. And because of the increase in PPE, that can be done. So my order today includes additional ways and circumstances that doctors can begin returning to certain surgical procedures, as well as procedures to diagnose and treat diseases of certain types. And the details are written by both doctors and lawyers, and it's the kind of thing that the medical board will be issuing advisories on, and all the doctors and nurses and healthcare providers, they will understand exactly what it provides. But for you all, the bottom line is this, and that is there will be more doctors and nurses allowed to treat more patients under the new standard issued today. Another thing issued today is there was a time when we wanted to make sure we were doing all we could to continue to slow the growth of the coronavirus, and as a result, I ordered a closure of state parks in Texas. Because of where we are now, and after consulting with the doctors on this issue, we feel that it is safe to allow state parks to reopen. In fact, it may do more for positive mental and physical health to do that as opposed to endangering public health through any potential exposure to COVID-19. There are limitations on visitors who do go to state parks, and this all begins on Monday. And that is, they should go only either individually or among family members. They can't be in groups of more than 5. They should wear some type of face mask, understanding that when you're out almost anywhere, but especially at a state park with blooming flowers and things like that, you're going to be sneezing more than you otherwise would be, and doing things like that that could be transmitting any type of virus. And so we want either a face covering or a mask or something like that. And so those standards are in the executive order for people to abide by, but we're kind of hoping and encouraging people to get out to the state parks as long as they're not, or let me say this, as long as they're following safe distancing strategies. And then also, one thing that we did in Mount Worth today is establish what we'll call it a toe in the water of expanding business in Texas. It provides what we call retail to go. As you all have observed over the past month, there have been several retail establishments categorized as essential services that have been able to provide retail to go. It could be restaurants providing food. It could be your local store, whether it be a grocery store, hardware store, some other type of store that fell under the essential services category, where you could order an item, maybe pay for it in advance, drive to the store and pick it up, and where they put it into your trunk or your back seat, where there's limited personal interaction. Or it could be that you deliver it from a retail store that's going to be delivered to your house either by Amazon or by the store itself. Because these strategies have been able to work effectively without expanding COVID-19 in the state of Texas, the thought process, why not allow all retail establishments to do the same thing? Now I realize that not all retail establishments are going to have the capability of doing this, but for those that can, we should allow them to do so under the same limitations that the current retail establishments are under. And that is, no one will be allowed to go inside any of these retail establishments that we are opening effective next Friday. Instead, the only way that people are going to be able to buy the goods up and getting it or having it delivered to their home or other location, and working out payment in advance, hopefully. And that way there will be more stores, and not talking about any type of retail. It could be clothing retail or just whatever type of retail you can think of in your mind. If you are involved in the retail sector, beginning next Friday, you're going to be able to sell retail to go of whatever retail you're trying to sell. And this is going to be a statewide, in effect, order for all of these establishments, understanding that we have it structured in a way with certain rules that retail establishments are required to follow. And there's a website address that provides those rules. And we will be able to give that address to you here shortly. A couple of other things that were done, and then some messaging about where we're going. Based upon the advice of doctors, that the determination was made that it would not be safe to reopen schools through the remainder of this school year. As a result, I've ordered that all schools, whether public or private or higher education, are closed for the remainder of this school year. Commissioner Morath will be in charge of providing information to public ed, and the Harrison Keller, the Commissioner for Higher Education Coordination Board, will be responsible for collaborating with all higher education institutions in the state of Texas to work out what's going to be done in concluding this semester, but also work out what will be done in the summer semesters to make sure that schools will be able to continue to provide education services to their students, but also do so in a way that doesn't compromise health and safety with potential spread of COVID-19. So the next thing coming up is going to be more executive orders issued in 10 days on April the 27th. These executive orders will be orders looking for additional ways that business can open up in Texas effective May 4th or later. And there will be several things that factor into this decision-making process. One will be information provided to us about different types of businesses and the types of strategies they can use to ensure the reduction of the spread of COVID-19. Two will be, we will take those strategies and then we will run them by our 4-doctor team and get the doctor's input about, is this okay or is this not okay? If it's not okay, what needs to be done to make it okay? And then after all of that analysis is done, we will be announcing, hopefully, more businesses that will be able to open up in May. Understand this also. Part of the analysis that the doctors will undertake is their ongoing monitoring of where Texas is a state and where your particular county stands with regard to the status of the coronavirus. Right now, the state appears to be maybe getting close to leveling off. Premature. We need to see ongoing days of similar numbers, but it may be that we are in the process of leveling off. There have been some forecasts showing that Texas will have peaked at the end of April. If that turns out to be true, if we're able to see that more clearly by April the 27th, then it's fair that we will be able to make some type of announcements effective on May the 4th, a date after which Texas will have already peaked. And so bottom line is we're expecting more information coming out on the 27th. And then, listen, we won't be able to do everything on the 27th because the last thing we want to do is to open up some areas of business, only have to go back and close them down. And so we'll be cautious in moving forward, just taking baby steps, one step at a time, but understanding the need for all regions of the state to get people back to work. You have people whose livelihoods have been destroyed, and we know they need to get back to work so they can earn the money to pay their bills. And we want to help achieve that as long as it is done in a way that protects the health and safety of the people in your region and make sure that we don't compromise any lives. So that being said, why don't I, like what we did last time, there were questions that were submitted, and we want to answer those questions. And as we answer those questions, I want to tell you this. I'm very proud to say that we are joined today on this phone call with U.S. Senator John Cornyn, as well as Texas Attorney General Ken Paxton. And they're here not to listen. They're here to help answer questions. I realize some of your questions may involve like federal funding, for example, and we will be looking to Senator Cornyn for that, as well as some other answers. Like last time, there were certain legal issues that Attorney General Paxton had keen insight on, and again, that may be the case here as we work our way through the questions. And so, Senator Cornyn and General Paxton, I'll try to give you a heads up before I ask a question if I think there may be one coming your way. But I want to try to get to as many questions as possible. So let's start. How can a county judge find out what PPE resources are available in the area? Who pays for these, and who is responsible for procurement? So but before that question is answered, let me tell you that alongside here with me in my office today is Chief Nim Kidd, Chief of the Texas Division of Emergency Management, as well as Dr. Hellerstadt, the Commissioner for the Texas Department of State Health Services. And so they will be answering questions as appropriate if it falls within their subject area. This one happens to fall within the subject area of Nim Kidd. So you got the question?
I think so, Governor.
Okay.
So 2 paths for PPE distribution across Texas. The supply side came from the strike force that the governor put together. So far, we have received and distributed 11.6 million masks. That's a combination of N95, KN95, and surgical masks. In addition, the Federal Air Bridge has supplied 4.1 million masks, and those are going back into the private sector, the large distributors that are pushing them out to hospitals. That total is 15.7 million masks. 2 paths that those are getting to our local partners. One is distribution through the HPP, the Hospital Preparedness Program, that's going down to the racks to go to hospitals, EMS, and in the coming week we will be working on nursing homes and then private practice physicians. And the second, many of the counties have received parts of their STAR requests that are being filled. And so as the trickle has turned into a little more of a steady stream flow, you will see more PPE coming to your jurisdiction.
Thank you, Nim. Next question. This is a three-part question, but I think it asks what is on the minds of a lot of you. I'm going to read all three questions, and then I'll have Dr. Hellerstedt and Nim Kidd, and because this involves a kind of a supply chain issue involving testing, we have also with us Dr. John Zerwas, who has been involved in supply chain operations for healthcare writ large, and he may want to chime in also. So it's a three-part question. It says, our hospitals are trying to purchase the Abbott Lab ID Now testing kit. Our rural counties to ask for supplies from the state, but is not getting them. Can you please help? Then a related question, why is Walgreens getting the 15-minute test kits and not our local hospitals? And then where can we purchase the 15-minute serology test? So let me first go to Dr. Hellerstedt.
Yes, so as far as the Abbott ID Now, most of that went out through essentially their usual commercial distribution. In other words, the platform that this works on, the instrument or meter that's used to do the ID Now COVID-19 analysis is those machines have been in many places all over the state, and so basically those existing machines and those existing locations got first priority, if you will, for the distribution of additional kits. We in public health did in fact receive 30 ID Now machines and 34 test kits, and we've distributed them across 30 counties in Texas. And if I can read the names of those, or that if you want to ask me a question later, I guess we can get to that. We had an additional donation from the HCA system here in Austin that provided us with some extra kits. So really the supply of the Abbott ID Now kits has not been something that the Department of State Health Services had a whole lot of control over. We had a small amount, and we did distribute them to areas that we thought they'd have the biggest impact in terms of serving areas that may not have had easy access to the kit. And I think that really explains the Walgreens part of it. As far as the 15-minute serology test, I'm actually not all that familiar with it. The serology tests that I'm aware of are laboratory-based. If these are home-based kits, I would say that I would not see their usefulness necessarily. I can't speak to their validity. And one of the things that's most useful in any of the testing that we do in this COVID-19 crisis is gathering data at a public health level so that we can understand the patterns of infection, which is what the COVID-19 tests are about, and then the emerging pattern of antibody formation to COVID-19 infection, and that's what the serology tests are about. So serology means testing for antibodies in the bloodstream, and you would form those antibodies if you had COVID-19 and then recovered from it. So if an individual does a serology test, I can't speak to its validity. And the other thing about it is it would only be something that they would know the results of, and that wouldn't go to public health, so we couldn't understand it. We are looking at other ways. There are laboratory-based types of testing procedures for the antibodies that are coming out. And as those become more plentiful and more widely distributed, we hope that we will have a way to collect that data and understand the pattern of antibody formation, which is, we believe, reflective of immunity, some level of immunity to COVID-19 after having had the disease and recovered from it.
Further on your part? Governor, the only thing I would add is, and Dr. Hellerstedt said this, I'll just restate it. The reason that Abbott is sending their ID Nows is to their existing customers. And we know that there's about 21 organizations across the state that previously had Abbott equipment that were able to run these tests. Those were located in Austin, Dallas, El Paso, Fort Worth, Galveston, Georgetown, Houston, Lubbock, Round Rock, San Antonio, and Webster. Those are the first groups that are going to start getting and pushing. Those test kits right now are about 48,000 individual kits that are out there to be taken. And our goal over this next week is going to be to put an interactive map out that will show where all the locations are, in addition to spreading those tests out with the 30 additional test kits or testing machines that Dr. Hellerstedt just spoke of.
Any further?
I'll just say that testing is an incredibly important part of our Reopen Texas strategy. As one of the physicians that's involved in this, we recognize that this is incredibly important to have a robust testing system out there. The governor has provided us excellent leadership on that. We're continuing to develop more platforms and do more testing as much as possible. Testing is not just a single step. It's about getting the samples. It's about having the various chemicals or reagents that are necessary to run the test, and it's about having the right testing platform. Abbott ID now is nice because it's very quick and you know immediately, but the high volume, fast throughput testing platforms are the ones that are going to allow us to really do some mass testing and really keep up with the reopening strategies that the governor has outlined.
Thank you very much. Another question about testing.
Josh.
What are we doing to help get testing down to the Rio Grande Valley?
The questions that are submitted were submitted in from yesterday through the email address that was provided with the notification, and through previous calls you'll see continual ones coming in. Our purpose here today with the call is to begin to lay out our path. Given the fact that we have our 3 new orders here, and Mr. County Attorney.
But we talked about one that we knew was coming was the healthcare. And then the other area, of course, we talked about the new CISA 3.0 list, which is the new list of essential businesses. I think if we're going to continue with our order, we need to update the CISA list. Couple of other things, which it's been interesting to me to see that our order. I happened to get some feedback on the order that we had done. That order ended up getting circulated all around with our locked door policy in there. And then you listen to what the governor said, and I don't by any stretch of the imagination say that Henderson County is the sole reason that the governor did this, but you heard what he said. There are some jurisdictions that are allowing businesses to operate in this manner, and it's worked well without adding to the increase. And then yet here the state has rolled out its own version of allowing small businesses and non-essential businesses to operate. That starts on the 24th. And they have put out a separate set of directives, which I'll go back, well, let me finish. They've put out a separate set of directives that he referred to in his phone call as being on a website. I have that website link, and those are actually done by the Texas Health and Human Services. And it provides the requirements that a business shall follow or shall meet in order to operate under what we call a locked door policy, but in order to operate under the governor's order beginning on the 24th. I think that, again, if we're going to continue with our own order, we probably would want to go in and incorporate those requirements into our order under the section where we now have it as a locked door policy in our order.
Just by incorporating that language
into the body. You know, the other thing that I'll just throw out there for thought, and you guys know, I throw things out, but these orders are your orders, so you guys can do what you want or do what you wish. But if you will recall, I particularly had been against a lot of these local orders and against the orders in general for a myriad of reasons that I don't have to repeat or get into today. But one of the big ones with me was we did an order so we could address the small businesses and allow them to operate at some level, which at least brings up the question in my mind. Everything else we did in our order, with the exception of the locked door policy, allowing those small businesses to operate, and the Airbnbs, everything else in our order was already included and is already included in the governor's order. Well, if the governor now has gone back and addressed my issue with the small businesses, the only difference between what we're doing and the governor would be doing would be the Airbnb order, which could bring the question up, do we even need our own order at this point? If we want to keep those Airbnbs subject to some regulation, then yes, we would. If not, we could let our order expire on the 24th, amend it to remove the medical stuff effective the 21st, move the expiration to 24, and after the 24th, everybody would be operating under the governor's order. If we want to, so that would be one option for the court. Another option for the court would be that we go through and amend it. On the issue of the Airbnbs, if I can touch on that a little bit. Just so you guys know, I've gotten a lot of feedback from Airbnb owners that obviously they wish we would remove or lift them from restrictions. I think for the most part there's a lot of them complying with that order and they haven't been renting. But I have had some that say that they could rent for longer terms, 30-day rentals, 60-day rentals, or some longer term if what we were seeking to stop was the 2- and 3-day rentals. And so again, we can leave that, I'm throwing that out for thought for the court for Tuesday's meeting. We can leave that, you know, the same as what we have it now. And if we wanted to go in and change that definition some and allow 30-day rentals minimum, I wouldn't go any shorter than 30 if it were me, but 30 or 60 days we could. Either way, that order set to expire on the 30th. That's only one more week. By the time we make it to Tuesday, they'll just have one more week of the old order. But again, when I'm asked to communicate something to you guys, I feel like I'm obligated to communicate it to you, and that's what I'm doing by telling you. In the last 2 or 3 days, most of the email inquiries that I have received have been from Airbnb owners. So, what y'all have for me? Those are the areas I think that we will need to address on Tuesday. The medical, which I think is real easy, I think we can address it just by removing our paragraph F from it, and the hospitals and medical providers will operate under the governor's order effective on the 21st. The locked door policy, like I said, I can go into our existing order and I can redraft it to mirror the requirements of the Texas Health and Human Services, and we can change it. I can update the CISA 3.0 essential business list, and then if you want any changes, then you guys can communicate with me over the weekend or early next week as to your thoughts on the Airbnbs, or we can discuss that in court on Tuesday next week when we look at this order.
Our locked door policy, he referred to it as a retail to go?
Yes.
Is that, was the wording, I took notes, is it?
And it's very similar. They don't require a locked front door. And I'll tell you, there's a reason why why I selected that language.
I was just interrupting. Yeah. It's in the governor's order, GA 16, on the 3rd page, middle of the, is where it is spelled out. So, sorry.
Okay, thank you.
One reason and I guess I shouldn't say I required the locked door policy is from an enforcement standpoint. If the peace officer can walk up there and pull on the door and the door's locked, then you know they're in compliance with keeping the public out. Otherwise, it gets really, really difficult from the enforcement side with not knowing whether they're in complying or not. When it looks like they're open for business, you don't know if customers are able to walk in and go to the counter or not. But so the locked door provision is not in the governor's. Just like ours, the public is not allowed to access or enter the building. All transactions have to be done, home delivery, curbside, over the internet, have to be exchanges as brief as possible. All of that part is exactly what we did. The only other difference that he has is specific rules on the employers, and he has required that they train all of their employees in environmental cleaning, disinfection, hand hygiene, and respiratory etiquette. He's requiring that all employees of one of these businesses must be screened before coming into the business, much like we are here at the county every morning, where they take my temperature every morning and they ask me a standard list of questions. I went to see my doctor the other day. They did the exact same thing, asked the same questions that we asked. So these small businesses would have to take temperatures of their employees, ask those screening questions. They require that the employees wash or sanitize their hands when they get to work. All employees must wear face coverings while at work, and then all employees must maintain 6 feet separation from one another, which that's part of our order also already. But those would be the additional requirements upon those businesses that wanted to operate that.
Is that in our order right now, of the face shields and everything?
Not the face shields. What our order says right now is they operate, but they must meet the standards and guidelines of the CDC,
Okay.
which would be the social distancing and the hand sanitizing and all of that.
But if it doesn't say it in our order, then the governor's order?
On the 24th, when this takes effect, the governor's order would require whether we change ours or not.
Okay.
Given this change in retail, I was trying to find, there was great emphasis in the beginning of this that retail food industry was kept going. And I'm looking in GA 16 trying to find that. I cannot seem to find it, and I'm assuming that since they are now specifically saying retail services, they're hoping that would encompass your drive-through restaurants and things of that fashion.
It states something about it in that next to the last paragraph where it says,
Yes, there it is.
however,
There it
the use
is.
of drive-through pickup or delivery options for food and drinks is allowed.
Okay, yeah,
Highly
but
encouraged.
there it is. They did not change then from the previous wording. Okay, so that would still be moving. And like you said, that is the state's version of providing the service except without a locked door.
Right.
Okay. It looks like the church's meeting stays the same.
I think everything, I've already received a call on that after the governor's presentation, but I think for right now, nothing's changed with respect to the churches. And honestly, I'm not aware of a single issue that we've had that's been brought to my attention by law enforcement or anyone else with respect to church services.
In GA 16, and I believe it was in the other ones, we had some discussions, or it was brought to us. In the second to the last paragraph, it discusses the suspensions of certain sections of the Texas Government Code under Chapter 81, subsection E. It's in the second to the last paragraph. That is a continuation of previous activities as well. That's not any new suspensions of authorities under Chapter 81.
That's right.
Okay.
Yep. And then again, it's restricting essential services. So any local order that restricts essential services.
Okay. Thoughts, discussions? Gentlemen? Well, the governor did speak specifically to hospital capacity. And one of the interesting things is that within our region, which is Trauma Service Area G, there's almost 1 million people. The population's 970,000. Of that, it is reported that there are 43 individuals that are currently hospitalized in that Region G for COVID-19. I found that interesting as he was discussing capacity at the hospitals and based upon the actual capacity versus the need.
And I think he made reference to the fact that some of the early projections, we were basing it on other countries and places like New York that just have not came to fruition here, and I think that's why he initially put in the restrictions on medical providers, doing elective procedures. And I think now they're seeing that maybe the demand for hospital space in certain areas is just not going to be there. And thankfully, we live in one of those areas.
Yeah.
I think that could be more significant and more serious in a very high-density populated city or place.
Agreed. That's basically what's being seen is that those high density population areas are the ones running the higher risk. Discussions? Well then, in summation, as you look at these, actually GA15 will go into effect 11:59 p.m. on April 21st, which coincides with our next court date. GA16 will go into effect at 11:59 on April 30th, which also coincides with our current order's expiration. And GA17 really has no bearance upon any of our orders, given the fact that this is the creation of the strike force to open Texas. It just delineates how the strike force is going to work and meet. But it is something that they're going to bring ahead rather quickly, given what he said on the call, is that the 27th, they'll be moving forward with recommendations from the strike force, hopefully for a May 4th target date of implementation. So.
And the only thing, I just want to make sure that we're on the same page with what he said. But GA17 also started his curbside retail pickup on starting Friday, April the 24th, which, unless my mind's off, it's Friday. Is that Friday? Second, third, fourth. Yes.
Yeah.
So yeah, Friday, April 24th is when his curbside pickup goes into effect. And I'm looking at page 2 of GA17.
Right.
So we'd have to amend our order to state that also, wouldn't we?
Well, we're basically doing curbside.
Yeah.
Yeah,
now,
the locked door policy.
Yeah.
Like I said, what I would propose that we do on Tuesday is we just change ours to mirror what he's doing.
So that would be to remove paragraph F.
But I still argue, and I know there's been some disagreements with this, but I still believe that is a change that we can make. And so in other words, I think we can make those changes and ours continue just the way they are until, I don't think we have to wait till the 24th to do that. And the reason why, and again, I just want to make sure everybody understands, is what the governor's order says is that we're not allowed to to make any changes to essential businesses. In other words, he's saying we can't change the way essential businesses operate. Those retail establishments that order applies to are non-essential businesses. We're allowing those small non-essential businesses to operate. So in that regard, our order as to essential businesses does not conflict with or contradict the governor's. Our order with non-essential businesses does. And we're actually allowing them a little more latitude than he is by allowing them to start 3 days early.
And so in 16, that would say that where he spells them out as, what was that? The bars.
Okay. Those would not be affected.
Right.
So they're in a completely separate category.
They're in non-essential. They couldn't do a locked door policy or anything like that.
It's not going to affect your barbers, your hairstylists, your massage therapists, your tattoo parlors, piercing parlors, gyms, or any of that.
With GA 16 and 17 laid here next to each other, I've noticed something. GA 16 is effectively will be in effect for 1 week. At the bottom, it says this executive order shall remain in effect and in full force until April 30th. And when you move over to the third page on GA 17, the paragraph following number 3, immediate deadlines, it spells out here, with executive order GA 16 set to expire on April 30th. So it looks like GA 16 is an interim order while they wait on the recommendations from the task force.
I would probably suspect that, but within a week of next week, so by April 30th, yes, you're going to see some additional orders come out.
Okay, so if we can make our order by removing of the medical designation in there, our orders will end up expiring on the 30th, right along currently with GA 16. And the playing field will be reset at that point, on April 30th, according to, if you look at GA 17.
Yeah. And that was the other justification in my mind, again, the way I feel about it, that was the other justification for us having our own order. One, as I've already said, I didn't like the way that small businesses were being treated in the governor's order. But then the second justification is I hope that people watching today is, here in one day, we have 3 sets of orders issued by the governor, and they all have different start dates as to when they start, and they all have different end dates. And to me, it was confusing, which is why I think the way we did ours was a little clearer as to here's the rules that apply to Henderson County. And, depending on what happens on the 30th, which we would meet again on the 28th, then hopefully we would know kind of what things we're looking at to decide what we wanted to do with that. Or we may even have to call a special meeting on the 30th if we don't know on the 28th what's going on, because we may on the 30th, if the governor can come in and clean up some of this on the 30th by unifying and issuing a new order, we may not need our own separate order. If he still unclear, we may want to look at extending that.
Well, I think the only reason, we followed the governor's directive pretty much with our order anyway.
With the exception of
the only reason we had an order, period, was just to explain some of the things in his order. We knew going in that it was 22 pages long, but it's 22 pages long, so you can look at our order by itself and see what all the essentials and non-essentials and all the businesses that can't be open and the locked door policy and all of that. You can look in one order and find that. Well, we've got 3 right here today.
And then they still refer to the SISA list, which we put the SISA list in ours, where he just says, go find the SISA list and look at it. And then he refers separately to the Department of Health and Human Services to see what the provisions were, which we put our provision in ours. You're
So,
right.
I mean,
Yeah.
I think we should follow and carry on with our own order, mirroring his order,
Right.
but having a little bit of explanation to it.
Yes.
Yep. Well, just as the governor was very adamant that his GA 14 was his stay-at-home order, he even referred to it in the call, being that GA 16 replaces GA 14. And from what we see here in GA 16, that expires on April 30th, unless they come out with a recommendation, it appears that the governor's stay-at-home order will be lifted at that point, if they do not.
If they do not do so.
Because currently, there is nothing other than GA 16 from the governor's office that is set to expire for April 30th.
Right, but, and I would suspect that we will see some other orders come out right on the 30th or right before. I mean, and we know our peak date continues to change, but right now our projected peak date is still the 29th. And if that's the peak, you know, you've still got that downhill slope on the backside of 2 or 3 weeks that they're projecting out. And so I don't see him completely lifting everything on the 30th, if that is truly the peak. Again, a lot of things could change. I've frankly been surprised at how slowly our numbers trickled out. I kind of expected we would have taken a bigger jump this week, and we see we were at 10, and we've trickled up over the week to 13. I think that's really good.
Judge, on GA 17, under immediate deadlines, he kind of spells out a couple of sentences in there. It says this shall include recommendations about any prudent reopening measures between now and May the 1st. So that's where I think, like we have been saying, that's where we're going to see some new orders come down.
Right.
Before his April 30th deadline when the 16th expires, so.
Right. Well, having all three laid out and knowing how they lay together, because I believe there are 7 orders in total that have been issued in this, because 8 was superseded, and then we have 9 through 13 now supersede 14, then you have GA 15, 16, and 17. So, because 9 will expire, or at this one, it replaces 9, so 10 through 16 with 14 expiring also. Okay. All right. Anything else, gentlemen, concerning the phone call and the orders?
The strike force, do you get a feel for that, Clint? I know, is it James Huffines? Was that the guy they appointed? It was on TV. Do you know any more about who that is, or is that the governor will appoint some of these people on this strike force?
Yes, but I don't know the insight into
Okay.
how it was done or how it was
Okay,
handled.
I'm just curious how that,
I don't.
where it went.
The insight.
Okay.
Anything else, gentlemen?
I think a lot of things, I probably should just shut up, but I think a lot of things, that the reason I was hesitant on answering is, and I don't know that there's a good solution for this if you're the governor, but it just seems like when you look at the appointments to a lot of those strike forces, they tend to represent the urban areas of the state.
Right.
And that goes back to, they're assembling a strike force that are probably very familiar with the issues and the problems faced in their urban area. They are probably not very familiar with the issues that are faced in Henderson County.
Right.
and
What we're dealing
small
with.
rural East Texas counties, or rural counties all over, South and West Texas counties that largely are unaffected by the virus, but can be very much affected by the impact of statewide orders.
Well, and that goes into their discussion about PPE and testing. All of that is focused at those urban areas. The discussion on PPE about the distributions, those are targeted to your urban areas. And again, goes back to the population density, and having that population density increasing their risk of transmission. So, any other thoughts, comments?
I just like to say thank you to the people of Henderson County. We're pretty well in between a couple of counties that numbers are increasing steadily, and our numbers are trickling in now. In the next few days, that may change, but I think I know if you look on social media and everything else, people griping about somebody not doing this or not doing that, but I think we've done well enough to where our numbers have stayed low, and I think that's a thank you to the people of the county that's taking this seriously. Continue to do that. Continue to wear a face mask if possible, wash your hands, and practice social distancing. That's the only things that can slow it down, and maybe we can get through this and get our economy kicked back in. But we've got to use our hearts and our heads in this situation. We can't just use one or the other. It's too broad, and we can't see it. So just keep doing the things that we've been doing and practicing the things we've been practicing, and hopefully we'll pull out of this sooner than later.
Along that same line, we found these numbers, and along with this was that 2008-2009 financial crisis, the height of the impact of the unemployment, specifically for that, and it took several months to get it, was 15 million. In the past month, there's 22 million that have filed for unemployment in 1 month, where it took, I believe it was 16 to 18 months to reach that 15 million back in 08 and 09. So you're exactly right. What we are doing with these policies are helping prevent it, but there's that second issue that is coming too, that the governor and them are now stepping forward to look at. And these nonprofit organizations that have picked up and really assisted as well, food pantries, those sort of the churches and the others, there has been a lot of resources provided that we're going to have to be looked to even further in the future. So.
I'd like to also say, the Emergency Operations Center still meets twice a day, 5 days a week, and you got the sheriff, the fire marshal, your county attorney, your county judge, a commissioner, and it's a lot of time and work going into these decisions. And again, it's not easy, but I do appreciate all the work that everybody's put in. And it's not just winging it. We're studying it and doing some stats and looking at and listening to our constituents. So thank you for the committee that emergency management coordinator. I didn't want to leave Joey out,
and our financial
Anne Marie Lee. So they meet twice a day, every day, Monday through Friday. A lot of time and effort goes into it.
Anything else, gentlemen?
I think in most part, the people of Henderson County are abiding by our order, and I also want to thank them for doing that and continue to be careful and do what you're doing. I think this county is one of the best counties in Texas, and I just want to say thank you to the citizens of Henderson County also.
I have nothing else to say with what everybody else has said. I just thank you for what all we've done, or y'all have done so far, and we continue to do as a county. But it's social distancing and numbers, 6 feet apart, less than 10 people and wash your hands and, you know, I know my bald head looks funny in a mask, but when I go out, I'm in a mask. I don't want it. And we're, I think trying to take care of our own the way the committee has done to prepare ourselves and to prepare our hospital. And a big thank you to our deputies, our first responders, our nurses, the doctors that are having to go in and not knowing what they're going to face on a daily basis is great. So the number 13 right now looks, as I know, is sometimes an unlucky number, but it looks like a good number today for Henderson County over the last 3 to 4 weeks. So thank y'all for what all you've done.
Well, there's one other group that needs to be mentioned, and that's our department heads. I have, you get tired of me hearing it, and I've been with the county 26 years, but I have never seen the cooperation, the teamwork into such a high degree under the most stressful situations that we have experienced, and I want to thank each and every one of them and for what they have done in implementing all of the new technologies to keep operating, because all of the essential services have to continue, and that's in implementing. Zoom is the big communication device now and used quite a bit, and we have had cases of COVID get very close. And that has added even more stress, as it would for anybody, but even inside the operation with the departments. And I'm very proud of all the departments, not only the ones that have worked together exclusively on COVID, but those in the other portions as well that have had to keep operating through this. So a big thank you to them. So if there's anything else, gentlemen, we'll entertain a motion to adjourn.
I'll make a motion, we adjourn.
I'll second the motion.
Motion made by Commissioner Chaney, second by Commissioner McCam to adjourn. All those in favor? 407.